Okay, start.
Yes, sir. Very good evening, everyone. मैं स्नेहा जाधव आपका स्वागत करती हूँ। आज हमारा देवेंद्र जी Yeah, thank you. Okay, so very good evening once again to all the participants of Sports and Exercise Psychology Diploma course के लिए जितने भी participants हैं उन सभी का हार्दिक स्वागत है आज के इस सेशन में। जब तक हमारे स्पीकर कनेक्ट हो पा रहे हैं तक I would like to share few things about the practical part. तो हमारा जो ये कोर्स है जिन्होंने स्टार्ट किया है वो कमलेश सर जी हैं, पिसालकर जी डायरेक्टर है ओशियन इंटरनेशनल साइकोलॉजिकल एसोसिएशन के। सो वेरी गुड इवनिंग सर एंड वेलकम टू दिस प्लेटफॉर्म। So I will just roughly brief you once again about the course. तो ये कोर्स जो है ये ऑनलाइन कोर्स है, हम कर रहे हैं। तो इसके ऊपर आपने जितने भी हमारे वीडियोस है उन्हें देखना है। Okay, you will see observe the videos and note down the points. Towards the end of the year, there will be a Google form distributed. I mean, will be sent to you all. जितने भी पार्टिसिपेंट्स हैं जिन्होंने ग्रुप व्हाट्सएप ग्रुप ज्वाइन किया है वो आप सभी को गूगल फॉर्म दिया जाए। यू हैव टू फिल इन एंड सेंड इट, बट मोर फोकस इज ऑन द प्रैक्टिकल पार्ट। इस प्रैक्टिकल पार्ट में हमें क्या करना है, गूगल फॉर्म तो आप सभी को सॉल्व करना ही है, दैट विल गेट इट, एंड बट मैक्सिमम मार्क्स जो है वो प्रैक्टिकल के ऊपर रहेंगे। तो प्रैक्टिकल सेशन में we have kept a major focuses on the 3Ds, disease, disability and disorder जो है। Theory sessions में तो you have to all observe the video, जिसमें का question answers है Google form की तरफ से, and immediate responses रहेंगे। It is not that the form will be there for a sufficient of time. आप once open करते हो, open के बाद and then once you close, it is submitted. Okay. So for practicals, okay, आपको एक picture लेनी है. You have to take a picture on any available ground. You tag it like hashtag sports 21 disability and post it on the social media. आपको social media पे post करना है tag करके. Okay, so we'll come to know that you have done the first step. और ये आपको शेयर करना है गूगल क्लासरूम और व्हाट्सएप ग्रुप, जो आपने ग्रुप ज्वाइन किया है उस ग्रुप पे आप भेज सकते हो। ओके, काइंडली मेंशन योर नेम। ओके, अगर टैग किया है तो डेफिनेटली विल कम टू नो ओनली, बट इफ यू हैव डन इट बाय सम अदर नेम, ओके, तो आपका नाम और ये डेफिनेटली उसमें लिख के व्हाट्सएप ग्रुप पे भेज। वॉच एनी वन ऑनलाइन क्लास एंड राइट इट डाउन। ओके, make a PDF of it and post it on Google Classroom. कोई भी एक वीडियो आप सिलेक्ट कर लो, उसके बारे में आपको पूरी जानकारी लिखनी है। Whatever you have understood, you have to write it down and make a PDF of it. और फिर उसको आप PDF में कन्वर्ट करके आप हमें भेज। Out of 21 disability, select any child and bring him or her on the ground. किसी भी एक बच्चे को आपको लेके आना है ग्राउंड पे, किसी भी इन सेंस 21 डिसेबिलिटी है या 3Ds अभी हम फोकस कर रहे हैं, उनमें से किसी एक बच्चे को आप ग्राउंड पे लाके उसको स्पोर्ट्स प्रैक्टिस करवानी है। डू एनी स्पोर्ट्स प्रैक्टिस विद हिम और हर। राइट अ केस स्टडी ऑन इट एंड पोस्ट इट ऑन गूगल क्लास। आपको एक केस स्टडी बनानी है उसकी। केस स्टडी यानी आपको डेमोग्राफिक डेटा लिखना है, समरी लिखनी है, ऑब्जर्वेशंस लिखने हैं, उसका प्रोग्रेशंस लिखते हैं, सारी चीजें जो है मेडिकल का क्या क्या कंसर्न है, सो दैट इज ऑल कंप्राइजेस ऑफ द केस स्टडी। तो आपको वो एक केस स्टडी बना के आपको पोस्ट करना। नेक्स्ट इज once you have gone through all the videos, then make a short video of 15 seconds explaining the benefits of this course. आपको एक छोटा सा वीडियो बनाना है जिसमें आप ये बताओगे कि इस कोर्स का बेनिफिट क्या हुआ है आपको, या फिर what you feel are the benefits of this. Okay, just a video of 59 seconds. आपको 59 seconds का एक वीडियो जिससे आप बेनिफिट्स आपको क्या फायदा हुआ है इस क्या You have to write an essay on the ground available in or around your residential area. Okay? आपके आजू बाजू में जो भी रेजिडेंशियल एरिया है, जो भी ग्राउंड है रेजिडेंशियल एरिया में, उसके ऊपर आपको एक ऐसे लिखना है. Okay? So what to write and all, how to write, it's all up to you. एक basically ऐसे लिखती हूँ. Next is 3 minutes video should be made by you on sports ground versus mobile games. Wonderful topic. 3 मिनट का एक वीडियो बनाना है आपको जिसमें आप लिखोगे स्पोर्ट्स ग्राउंड वर्सेस मोबाइल गेम्स. डेफिनेटली ये डिबेट का विषय है, लेकिन टॉपिक है. आप किस तरीके से प्रेजेंट करते हो उसके ऊपर हम जांच करेंगे. ओके, मेक अ रील ऑन योर फेवरेट स्पोर्ट. डेफिनेटली ये सबसे फेवरेट टॉपिक आप सभी का रहेगा होपफुली कि आपको एक रील बनाना है आपके फेवरेट स्पोर्ट्स का और वो आपको भेजना है गूगल क्लासरूम पे या व्हाट्सएप ग्रुप पे या फिर यू कैन सेंड अस ऑन द पर्सनल थिंग, बट यू हैव टू write your name and details on each and every document that you are submitting because there are many participants who are sending it. So please make sure that it is always labeled. Okay, आपका नाम उसके ऊपर रहे. The details whatever about you should be mentioned on each and every assignment that you submit. जो भी assignment आप submit करते हो उस पर आपका नाम और आपकी details please mention. Okay, so look, these are the few pictures which I have shared with you on the screen. This is the sports ground where we take practices, what kind of exercises, what kind of sports or events we conduct. You can join. Okay, so thank you, and I'll just stop sharing. Hope you have all understood about it.
Stop karna.
Now I think our speaker has joined in. So हम ज़्यादा समय ना लेते हुए will let us move on to speaker. Yes. Dr. Ruchita. Yeah, we could have like hello. हमने आपकी आवाज सुनी थी. You can just try those headphones on your earphones.
Hello.
Hello. Yes, we can hear you.
Yes. Actually, I'm trying for this logging, but it's taking some time. So can I get the 10 minutes off?
We can hear you, ma'am, clearly. Can you just, I mean, आप जो शेयर कर रही थी वीडियो स्टार्टिंग में, आप वो शेयर करके देखिए और शायद आप ये आवाज whatever device you're using, ये क्लियर आवाज आ रही है यहाँ से.
Okay. No, actually, my presentation was on the laptop and its audio is not working. So I'm not taking it on the phone. So it's taking a little bit of time.
Okay, ma'am. Okay, fine, sir. Yeah, ma'am. Just keep trying and let us know. Yeah.
Yes. Okay.
Kamlesh sir will wait some time.
हाँ, एक सवाल है यहाँ पे.
Yes, sir. To get data. Okay, Devendra ji, this is the question you have asked, like how to get data related to sports and sportsman. Exactly क्या कहना चाहते हैं आप?
मैम, जो स्टैटिस्टिकल पर्पस के लिए यूज होते हैं डाटा, सपोज हमें कोई प्रोजेक्ट वगैरह बनाना हो तो ऐसा कोई फर्म, ऐसी कोई साइट या गवर्नमेंट डिपार्टमेंट जैसे इलेक्शन कमीशन वाले पॉपुलेशन का डाटा देते हैं, so authentic data, because I have been discussing this requirement of sport, जो कि हम अभी बडिंग स्टेज में हम लोग इसको डेवलप कर रहे हैं. I just wanted to know, is there any source? यदि हम कोई प्रोजेक्ट वगैरह प्रपोजल वगैरह बनाए या फिर उसको हम प्रेजेंटेबल वे में लाए, तो बिकॉज हम अभी बिल्कुल स्टार्टिंग फेज में.
Okay, so what way you are and how are you situated and आप क्या कर रहे हैं, means starting day position पे है, यानी what exactly you mean to say?
चलो मैम, I will come back to you later on. Okay.
Sure.
ठीक, थैंक यू.
मैम को ज्वाइंट होने को टाइम है, तो मुझे लगता है ये सवाल आप ले सकते हैं इसका जवाब.
Yes sir.
एक तो स्पोर्ट्स अथॉरिटी है, साई स्पोर्ट्स अथॉरिटी ऑफ इंडिया, वहाँ पे आप डिमांड कर सकते हैं. सेकंड है डिस्ट्रिक्ट स्पोर्ट्स ऑफिस रहता है, हर एक जिले में एक स्पोर्ट्स ऑफिस है, डिस्ट्रिक्ट स्पोर्ट्स ऑफिस, स्पोर्ट्स ऑफिसर वहाँ रहते हैं, वहाँ पे आप सबमिट कर सकते हैं जो भी आपका प्रपोजल है. उनके कुछ प्रपोजल रहते हैं यूथ के लिए, ट्रेनिंग के लिए, तो उनके अनुसार भी आप काम कर सकते हैं. वहाँ पे एक प्रपोजल देखिए, आप ज्वाइंट हो सकते हैं डिस्ट्रिक्ट स्पोर्ट्स ऑफिस से सीधे. तो प्रपोजल आपका देखकर. और तीसरा है जो भी बड़ी बड़ी महानगर पालिका है उनका भी एक स्पोर्ट्स ऑफिस होता है, तो वहाँ पे भी आप अपना प्रपोजल सबमिट कर सकते हैं. और थर्ड, आप जो सोशल एनजीओ है, सोशल एक्टिविटीज है, तो वहाँ पे भी आप उनको दे सकते हैं, डिमांड कर सकते हैं. तो ऐसे 3-4 जगह. लेकिन जिस तरह से पैसा चाहिए या कोई प्रोजेक्ट के लिए बहुत कम पैसा जो है स्पोर्ट्स डिपार्टमेंट और इस प्रोग्राम के लिए है, बहुत ज्यादा पैसा नहीं है ऐसा कि गवर्नमेंट इसके लिए देते हैं. ज्यादातर आपको अगर डिस्ट्रिक्ट स्पोर्ट्स ऑफिस का हॉल भी अगर चाहिए या जगह भी चाहिए तो उनको पैसा पेड करना पड़ता है, तो फ्री में नहीं है बहुत ज्यादा चीजें इसमें. और गवर्नमेंट बहुत ज्यादा पैसा पेड नहीं देती है इस काम के लिए, तो कुछ इंस्ट्रूमेंट प्रोवाइड करती है. अब तो ज्यादातर पैसा जो है स्पोर्ट्स का वो ग्रीन जिम के इसमें जा रहा है, आप देखेंगे तो बहुत कम है जिस हिसाब से लोग डिमांड करते हैं उस हिसाब से. हो सकता है आने वाले दिनों में बढ़ेगा.
सर वही हम ट्राई कर रहे हैं. मेनली वी आर लुकिंग फॉरवर्ड कि हमारा इसको पहले तो अच्छा फाउंडेशन तो हो जाए, थोड़ा स्ट्रॉन्ग, ताकि हम यदि स्पोर्ट्समैन को लाना चाहे और उनको फुल प्रेस, तो हमारे पास में एक बैकअप अच्छा सा हो.
हाँ, नहीं, जरूरत है बहुत ज्यादा फंडिंग की, लेकिन गवर्नमेंट नहीं कर रही है इसमें, बहुत ज्यादा नहीं है, जरूरत तो है.
डाटा वाला जो सर है, डाटा इज नीड फॉर एनीथिंग वी प्रपोज. एंड जैसे आपने बताया अभी साई का और डिस्ट्रिक्ट स्पोर्ट्स ऑफिसर, तो लेट अस ट्राई, क्योंकि बिना डाटा के हम प्रपोजल भी नहीं बना सकते.
चलो, हाँ,
डेटा
करना,
रिलेटेड,
लेकिन
data related to what means your
स्पोर्ट्स एंड स्पोर्ट्समैन मैम.
sports and sportsman. तो ये तो सर आपको कोई भी मास्टर्स डिग्री या पीएचडी होल्डर्स है जो स्पोर्ट्स साइकोलॉजिस्ट है या तो स्पोर्ट्स की एनालिसिस्ट, ओके, मोर देन साइकोलॉजिस्ट, आई वुड से स्पोर्ट्स एनालिस्ट जो होते हैं, दे कैन हेल्प यू आउट.
Okay, ma'am, let's work out.
Yeah, So there are very few analysts in India. Yeah. Those people can definitely help.
हेल्प लेंगे यदि कोई, इफ यू कैन एक्सटेंड सम हेल्प.
सबसे पहले अब ना मुझे ही ऑफर करते हैं, बढ़िया तेरा ही ख्याल करते हैं.
कोर्स का जो डाटा है आपको इनके पास डीएसओ ऑफिस के पास मिल जाता है पूरा. चलो तो डीएसओ की वेबसाइट भी है. जैसे नागपुर में वेबसाइट बनी है, ऐप बनी है, तो वहाँ पे बहुत सारा डाटा अवेलेबल है स्पोर्ट्समैन का, जो भी बच्चे स्पोर्ट्स खेलते हैं या स्पोर्ट्समैन है. और उनकी अलग से मैगजीन भी निकलती है, मतलब नागपुर में निकली है, तो उसमें भी आपको डाटा पूरा मिल जाता है.
ओके सर.
आपके डिस्ट्रिक्ट में भी निकली होंगी कई स्पोर्ट्स में डिस्ट्रिक्ट ऑफिस से, तो आपको डाटा पूरा मिल जाता है वहाँ पे. और ऑनलाइन भी उनका स्कूल का डाटा पूरा उनका, मतलब महाराष्ट्र में तो अवेलेबल है, ऑनलाइन मिल जाता है उनकी वेबसाइट पे पूरा.
ठीक है सर.
आपका कौन सा डिस्ट्रिक्ट है?
मैं नागपुर का ही लेता हूँ सर, वहीं का ही करूँगा.
नागपुर से. हाँ, तो डाटा है पूरा अवेलेबल, ऐप भी है.
ठीक है सर. देन आई
एक ऐप भी है स्पोर्ट्स का, आप प्ले स्टोर मिल जाएगा.
हेलो
हॅलो
हेलो. हाँ, स्टार्ट करते. हाँ
हॅलो
मैम. यस यस.
सर झालाय थोडं प्रिपेअर, झाली आहे स्लाइड्स प्रिपेअर.
ओके 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 मैम. नया मैम शुरू करते.
व्हिडिओ पण ना? मी कुठे दिसते?
नाही तो पण ते स्क्रीन शेअर आणि तो पण ते दिसतं.
Hello.
ओके.
हॅलो.
Yes, Ruchita. Yeah.
येस.
Ready?
सॉरी मॅम.
No, it's okay. So we start with क्या रुकावट के लिए खेद है सभी दर्शकों को. Okay, so we are sorry. There was a little bit of technological glitch. So let's move further. So हमारे जो स्पीकर है वो आ चुके हैं. So I would just brief you about her. Our resource person, Dr. Ruchita Kotewar. She's a physiologist at District Government Hospital, Wardha, Maharashtra. Am I audible?
यस यस.
Yes, thank you. She has done her master's in neuroscience in the field of adult and pediatric. She is the clinical therapist associated professor, worked at Pain Clinic, Pune. She has made a paper presentation on strokes rehabilitation in women IAP conference. Is the first prize winner in critical analysis competition at Scientific Pune. Workshop she attended are early intervention in pediatric, neurodevelopment, technique in disabled children, stroke rehabilitation, spine cord rehabilitation, pulmonary rehabilitation, and therapeutic tapping. Okay, so there's a lot to know from our resource person. And now I won't take much time. Let's move on directly to her. Over to you, Ruchita.
And hello, good afternoon, everyone. First of all, sorry for inconvenience and about the time. Uh, thank you for the hello.
Good afternoon.
Good
Welcome.
afternoon. Thank you, sir. Thank you, ma'am, for the introduction. Are you hearing me? Hello.
Yes, yes, very clear. Yeah.
Now, today's my topic is disease and exercises. What is the relation between disease and exercises? Why we should do the exercises? This is my today's topic. Now, we all mm, know about the disease. Disease is what? Disease is the illness. But by definition, it is a condition or deterioration which is affect the normal functioning of our body. It can be a disruption or a dysfunction of any part of our structure and our system of our body with the because of the pathogen or without the pathogen. It shows the symptoms which are the sign and symptoms. From that we can calculate or we can say that that is the disease. Now, what is the exercise? Hello? Hello?
You are audible, ma'am.
Yes, yes. Yes. Now, what is the exercises? Exercises are the planned and structural, physical and mental activity, which is mostly oriented to the goal, specific goal, which is that goal is that goal is to improve our fitness, health, and our mental ability. Uh, but there is a difference between the normal physical activity and exercise. Most of the people have a misunderstanding about the physical activity and exercises. They thought like that we are doing the physical activity every day, especially the females who work in the household activities. They thought like we are doing activities, then there is no need of exercise. But normal activities are not the exercise. We should understand the difference between physical activity and exercises. Physical activity is the activity of any movement of our daily living. That is, we do all the movements of our body in a home or at a garden or at our workplace. That is the activity. And exercises are the planned, structured, or repetitive or intended movement which are intended for the our improving our health, improving our fitness, in intended our improving our mental health and in with the all benefits and with challenging to our activity or our challenging to our ability is the exercises. I think you people have understood the difference between physical activity and exercise. Now, why we have to do the exercise? What are the aim to do the exercise in our daily routine? Nowadays, physical inactivity is one of the leading cause of disability and death in developing countries like India. And our lifestyle is also going to change every day. Now we are in a sedentary lifestyle. Now our working pattern is prolonged sitting and less activity level. So lifestyle diseases, the chances of lifestyle diseases like obesity, diabetes, hypertension, cardiovascular diseases like heart attack, ischemic heart diseases, the cardiovascular diseases, the chances of these diseases is going to increase. So this is our aim to decrease this all uh, complication of all these diseases and to prevent these diseases. Now our lifestyle or life our working pattern is around the stress. Now the our lifestyle is stress emerging. So now there is also our aim of life to relieve the stress also. So exercise is used to decrease or to relieve the stress also. Because of the exercise we can improve our fitness level, we can improve our mind health, we can level our activity or energy level. It means overall health benefit we can get from the doing exercise every day. Now there are number of type of exercises in which some are flexibility and postural exercises. Second one is the aerobic exercises. They are also called as a cardiovascular exercises or exercises. Third one is the strengthening exercises. Fourth one is the balance exercises. And fifth one is the coordination exercises. We will discuss this in next slides with brief. Now, what are the flexibility exercises? Flexibility exercises are the exercises in which our muscles get expand or extensibility and expandability of muscle increases in flexibility exercises. The joints get moving in the flexibility exercises. So we can, for flexibility exercises, we can use the some yoga poses, some stretching of muscles, and these flexibility exercises we should do every day. When we have, if we have started the initiation of exercises, we have to do the stretching exercises earlier. That is, we call it as a warm up exercises. And after the session of exercises, that is cool down exercises, we can put these flexibility exercises in cool down phase also. 10-minute flexibility exercises is enough for the one session of our exercises. Now, next one is the aerobic exercises. Aerobic exercises is mostly loaded. It provides the load on the cardiovascular system. Means it helps in conditioning of the our cardiovascular system. More heart is worked in these aerobic exercises. Okay. Now more oxygen is used in these aerobic exercises to produce the energy, and this energy is now then transferred to the muscle and improve our activity level. So overall, the cardiovascular endurance is increased in the cardiovascular strength is increased in these aerobic exercises. The form of aerobic exercises are brisk walking, normal hour walking, jogging, cycling, swimming, stair climbing, running. These type of exercises are called as a aerobic exercises or cardio exercises. Now, strengthening exercises. Strengthening exercises are the exercises which increases or improve our muscular strength. Muscular strength is required for the daily activities for to improve our stamina, and these exercises we do against the resistance. Then only the strength of the our muscle get increased by day. If we going to increase the weight progressively, this resistance can be provided by the our own body or therapist body, or by external forces like weight we are taking, like a dumbbells, then machines when we do the exercises on the machine resistance, then theraband exercises we can see it in the pictures, so you get the idea about that. And now the another exercise form is the Pilates. That is also the strengthening exercises in which the some positions and some with the movements are done in the Pilates, which improve the strength of our core muscles and our distal muscles too. Now, balance and coordination exercises. These balance and coordination exercises is mostly functional oriented. Means in some neurological diseases or in some orthopedic or muscular condition where the patient's balance, some cerebellum affection diseases where balance and coordination is affected. In that conditions, some functional oriented coordinated activities we perform like exercises, like one standing, one leg standing, like catching the ball. These are the balance and coordination type exercises. I think you all understood the types of exercises. Now, what are the benefit of exercise in our body? We all know that our body is a complex structure. The body consists of number of systems, that is cardiovascular system, nervous system, then musculoskeletal system, lymphatic system, endocrine system. These all are the systems consist of a body. Uh, so now there are number of researchers who says that there is a positive effect of our exercise routine or exercises on our every system of our body, on every tissue, on every cell and every organ of our body. So it is beneficial for our overall health. Now we see the some benefits of exercises in short, like help in weight management to reduce the obesity. Nowadays, the obesity is the big problem, or most 90% people in the India are having the problem of obesity. With the obesity, there is a other complications like cardiovascular complications, diabetes, and other lifestyle disorders, endocrine diseases also. So we can manage that diseases and obesity with the help of exercises. Because of exercises, we can reduce the chances of cardiovascular diseases, stroke, we can say that is hemiplegia or paralysis, diabetes 2, metabolic disorders like thyroid, hypothyroidism, hyperthyroidism, etc. Reduces the chances of stroke. It also reduces there is a studies that there is a reduces the chances of cancer if we do the exercise regularly. And if we are patient of cancer, still we are doing the good breathing exercises and doing the low intensity exercises, it will help in recovery or healing of cancer. Now, next is the our musculoskeletal system. Our regular exercises give the benefit to the our bones and muscle. It strengthen our muscles, improve our joint functions, and improve our bone mass. It improve the absorption of calcium and vitamin D in our bones. It improves our brain functions also. It increases the neuronal connections. It improves the cognition, learning abilities, concentration, etc. by releasing the number of by increasing the secretions of some neurotransmitters like serotonin, dopamine, these neurotransmitters. It improves the mental health also by decreasing the level of depression, anxiety, and increasing the good hormones or happy hormones. It also improves our respiratory functions. In respiratory functions, we also seen the effect of breathing exercises or effect of exercises in COVID period also. Now, the importance of assessment. Assessment is a very important part in prescribing the exercise or to execute the program of exercise or to give the treatment program to the patient or fitness or general fitness of a people. Why it is important? Because exercise is like a medicine nowadays. It help in preventive and treating the diseases through the exercise. Hello, hello,
Yes, ma'am.
hello.
Yes, yes, yes.
Audible, audible. Yes.
Continue,
Yes,
continue.
madam.
Okay, okay. Exercise nowadays, exercise is like a medicine. It helps in preventing and treating the diseases through the exercises. Proper evaluation is very needed to focus on specific treatment or specific illness and fitness goal too. If we have any neurological disease, so we have to properly evaluation is needed to where we should focus, where should be our goal. It should be so assessment is needed. Now fitness goal is our general goal for everyone, so at that time also fitness assessment is also needed prior the any fitness program. So we can see the person's abilities, so we can see the person's heart rate, blood pressure, vital parameters, and according to that we can prescribe the fitness program also. Now we have seen that because of the assessment we can prioritize the patient's short term goals, what would be the long term goals, what could be the treatment we can check up. It can be help in decide the home exercise program also. In neurological conditions, patients may suffer the for the prolonged time, or mostly the bedridden patient. So at that time home exercise program should be prescribed to that patient. At that time the proper assessment of patient's abilities and patient's all vitals should be checked, and then home exercise program should be prescribed. The assessment, we should do the assessment for the maximum benefit of the exercise treatment. The assessment is also help out to or rule out the contraindication, because in some conditions there are contraindication to exercises. Some symptoms are contraindicated, like in heart attack patient or in cardiac surgery patient, there are some contraindication where we should not prescribe the patient, because in that condition we have to rehabilitate the patient progressively, load the heart very progressively. So at that time we should rule out the assessment is helpful to contraindicated some conditions and to avoid the complications. Next one is for this all this assessment purpose, physiotherapist or expertise is required or is needed, and it will be helpful. Now, what is the role of exercises in cardiovascular health? The cardiovascular health, in cardiovascular health, there is a, if we do the exercise regularly, there is a more pumping of the blood by the heart. Because of that, there is a more oxygenation of the blood, and more oxygenated blood is supplied to the body of our to the cell, to every cell of our body. It also improve the strength of the musculature of the heart, that is the muscle of the heart also gets strengthened, so more pumping of the blood is there. Because of the good circulation of the blood in the body, there is the good increase in the good cholesterol level and decreases the bad cholesterol level, and it also maintain the blood pressure and reduce the hypertension also. So there is a benefit of exercises on the cardiovascular health. So if the any patient is underwent any surgery or in any conditioning or any, then at that time physiotherapist advice is required and supervision is also required. Now normal general recommendation for prevention of these diseases are to the patients or to the fitness program, the aerobic exercises we have seen already, that is brisk walking, swimming, jogging. These all the cardiovascular or aerobic exercises. Duration should be a 45 minutes, in which we can incorporate the warm up and cool down exercises like stretching exercises or small joint movements we can incorporate, and it is needed warm up and cool down exercises, and 20-minute sessions of moderate to high intensity exercises is required. 5 days frequency should be a 5 days a week. We have to do the exercises regularly. 5 days a week is needed to improve our cardiovascular health. Now, role of exercises in obesity and diabetes. In obesity, because of the exercises, there is a reduction of the fat and calories and improve the good muscle mass of our body. It also increases the metabolic rate of our body. Due to increased metabolic rate, there it helps to maintain our body weight normally, and due to which it increases the endurance and stamina of our body. And because of all these effects, the with the prolonged period of doing exercises, the our obesity get reduced and our healthy weight get managed. Now, in diabetes, there is a role of main role of exercises to maintain the glucose level and improve the sensitivity to the insulin level. So recommendation for this obesity and diabetes are the flexibility exercises, strengthening exercises, and aerobic exercises. Exercises plan should be of mixed type. That is, we can take it as a 2 day strengthening program of muscle, 2 days cardiac program, and flexibility exercises every day. And duration of these exercises should be 45 minutes. Intensity should be moderate and high intensity, and frequency of 5 times a week. Now, role of exercises in nervous system. Our nervous system is made up of cortex, nerves, neurons, axons, dendrites, etc. If we do the exercises regularly, new neuronal connections, if we do the movements, there is the neuronal, improve the neuronal correction, more signals to the brain, more output of the brain is there because of the exercises, and more activity level of a person. It helps in improving the conditions like stroke, neurodegenerative and progressive diseases like Parkinson's disease, in which patients sign and symptoms like tremors, their walking pattern getting changed, muscle activities getting changed, their coordinations getting changed. In which, if we do the exercise properly, then the person gets the um benefit to improve the flexibility, to improve the coordination in between them. Multiple sclerosis, in which patient strength get reduced by day. So if we do the exercise program for them, low intensity exercise program, we can make them independent, we can improve their quality of life, we can decrease their uh, deterioration level. So exercises are helpful in neurological all conditions. Our aim is to make them independent, make their lifestyle good lifestyle, and improving the quality of life. Physiotherapy assessment and advice is needed for the particular conditions at particular time. The recommendations for the neurological diseases are flexibility and postural exercises, low intensity strengthening exercises with proper resting period according to patient's condition, balance, and coordinated exercises. Then, role of exercises on mental health. Due to the everyday exercises, there is a increase in the good hormones in our brain, that triggers endorphin level, serotonin level, dopamine level, which elevates the mood and reduces the depression and anxiety. We can take the example, or we can take the experience, like if we feel that depressed, if we go for the walk or for a short walk, we can get, our mood can get elevated, we can experience that also. It lowers the level of stress hormones like cortisol or epinephrine. It helps in better sleep. If we do the exercises with the help of good exercises, patient can feel the confidence and motivated. Their self-esteem get increased or elevated. Their energy level increased. Their feeling of good well-being also elevated. See the benefits of exercises on mental health in this picture. Now, role of exercises on musculoskeletal system. It increases the flexibility and extensibility of muscles. It improves the bone mass and muscle mass. It improves the strength and muscle of ligaments. It improves the postures and alignments of body. So we can avoid the back pain, neck pain, that kind of injuries. It can reduce the chances of muscular injuries, ligament injuries. It reduces the chances of disability and contractures. It reduces the degeneration diseases like osteoarthritis of knee, like spondylosis of spine, etc. It also reduces the osteoporosis. This is the most mostly happen in older age and in females because of loss of bone and menopausal condition, bone mass and menopausal conditions. In this osteoporosis, there is a loss of bone mass and decrease the level of calcium. If we do the exercise like walking or weight bearing exercises, we can improve the bone mass in osteoporosis. Now, respiratory system. Respiratory system consists of lungs, alveoli, trachea, larynx. We all know that. If we exercise regularly, like breathing exercises or some sort of cardiovascular exercises, there is a more expandability of lungs is there. Lungs get more expanded. Because of that, so more air is entered into the lung and more oxygenation of lung is there. So more due to the more oxygenation in the lung, there is a filtration of blood, more filtration of blood, and blood is more oxygenated, and that oxygenated blood is circulated in our whole body. So more activity level is improved. Every the nourishment of every cell of a body get improved. So breathing exercises is very helpful. Breathing exercises also helpful in expulsion of cough. In some conditions like bronchitis, pneumonia, where the cough is the culprit. So at that time, the breathing exercises like cupping, huffing techniques, some chest physiotherapy is helping to expulsion of this cough. These breathing exercises clears the airway passageway of to easy breathe. It also the mode of exercises in respiratory system are breathing exercises, chest expansion exercises, chest mobility exercises, and we can do the pranayam in which we can do anulom vilom um, and other pranayam of the role of exercises in older people or geriatric people. The because of the exercises, we can prevent the fall in geriatric people. We improve their functional independency. We can maintain their quality of life and improve their longevity of life. Healthy aging we can give to the older people because of the exercises. The recommendation for the older people are stretching and low intensity strengthening exercises, balance and coordination exercises to prevent the fall. The duration of should be 20 to 30 minutes with a resting period according to patient's condition. Frequency should be 3 to 4 times a week. And group therapy should be incorporated in the older people to improve their motivation and to decrease their depression, which is mostly occur in the older age. We can see the exercises in older people, strengthening exercises, group therapy, and balance and coordination exercises. Now, role of exercises in children. Nowadays, childhood obesity is the big problem or complicated situation in Indian country because of increasing the screening time and prolonged sitting. So, with regular exercise, we can make them active and we can improve their stamina. Because of that, improve their overall health also get increased. We can improve their cognition, intellectuality, and concentration. We can motivate for this physical activity through the sport, swimming, bicycling, running for 45 to 50 minutes every day. It should be mandatory. In pathological conditions like cerebral palsy, Down syndrome, disabled children, delayed milestone, etc., physical assessment is necessary, and under the guidance of physiotherapist, we can give them the regular exercise program or short according to their goal. We can give them the exercise. Through the exercises, the goal for those children are to make them independent, improve their quality of life, reduce their complications of disability, and make them the optimal functional and to maintain their independence. Now, role of exercises in maternal health. Maternal period is also crucial period for the females. In that period also, the exercises help them to cope up with the changes which are occur in the pregnancy period. In antenatal phases, we give the exercises to ease the labor pain, to cope up with the labor pain. Breathing exercises is helpful in labor pain. We can, with the help of some stretching exercises, some pelvic exercises, some activities, we can reduce the chances of cesarean and increase the chances of normal vaginal delivery. We can reduce the complications throughout the pregnancy and at the time of delivery. Due to the exercises, we can expect the fast recovery after delivery in postnatal period. It also helpful in reshape the body in postnatal. Physiotherapist advice is needed and some antenatal exercises should be done under the supervision of the guided person or physiotherapist. Breathing exercises, relaxation exercises, stretching exercises are should be given in the antenatal period and postnatal period also. Number of researches are done in cancer patient about the relation of exercise and cancer. The resulted studies are it improves the immune function in our body, so there is a less chances of cancer. It also activated the antioxidant enzymes that protect cells from radical damage. If we do the breathing exercise regularly, or if we are the cancer patient also, breathing exercises improve our oxygen level, which help in healing the cancer. Low intensity exercises help the cancer patient in maintaining their optimal function. Do the regular, and now in this session we have seen the all the benefits of exercises in all the system and all the age group. So do the exercise regularly and live the uh, happy and healthy life. Thank you. Hello. Hello.
Yes, ma'am. Yes.
Yes, madam.
Yeah.
Hello. Yes. Thank you, ma'am.
Yeah, it was really very nice explanation about health.
Ma'am, slides uh, was there in the
Yeah, it
screen,
was
because
very.
I'm
Yeah,
not
it,
getting the feedback if slides are getting or not.
surely you'll get it. Like there must be a few questions from the participants. So
Yes.
let us see any questions, participants. Please, you may ask Ruchita ma'am as she is here.
Yes.
Good evening, madam.
Yes. Good evening, sir.
Madam, how to train for the autistic child in physical
Uh,
exercise? What is the foundation
okay.
of the uh,
Okay. In autistic children, there are a lot of different sign and symptoms. To every child is different. See, so we should go for their good prospectus, means good activities, and what they are. We should see for the what is the good in that child. What is it means where that child is good in activity, that activities we should encourage to them. And all stretching activities or all activities, if he is not doing willingly, we should motivate them through some um, play, some sport activities, which activities he likes. Like if he is doing some like to do some play, so encourage them. Through the activities we can rehabilitate them properly. Hello.
okay, madam.
Hello.
Madam, the basic is a coordination exercise for first or stretching exercise for the first. Which one is the
uh,
first, madam? Stretching exercise.
Stretching exercises will be beneficial for them.
Okay, madam. Okay, madam. Thank you, madam.
Hello.
Okay, madam. Thank you, madam.
Welcome.
Yes.
Madam, thank you,
Yeah.
madam.
Yes, yes, welcome.
Okay. Thank you, Vijay sir. Thanks a lot. Okay. One more question is there. Like, can you just put some focus on Pilates exercises? Yes, ma'am.
Yes. Pilates
Take
exercises
up.
are mostly for the strengthening purpose and stability of our body. In this, mostly our core exercises like abdominal core exercises, our proximal extremity exercises, means proximal scapular exercises. Those in that Pilates scapular exercises are mostly scapular pelvic exercises, and coordinated exercises are activities. All activation of core muscles are there. So strengthening plus balance is a combination of Pilates. Hello.
Okay. So that doesn't mean only the lying down exercises.
Hello.
Hello. Yes,
Ha,
ma'am.
yes, ma'am.
So that doesn't mean only lying down exercise. It is a comprising.
No, no, no. It is not only lying down exercises. We can do Pilates on the activity board also. Now in gym also there are some instrumentation for the Pilates. Ball exercises also, some exercise form of Pilates is on the ball also.
Okay. Yeah, basically
It
fingers
mostly for
upwards and
yes,
in and down. Okay. Okay.
it
Basically,
mostly focus on the activations of muscles and stability.
thank you, ma'am. Really wonderful explanation you have given on size and disease. So most probably all our participants will be happy to know about it. And any questions you can just ask. Any more questions if you have? or you can put it on the group. We will definitely forward it to Ruchita ma'am and get the answers. So be connected on our WhatsApp group. Okay. So thank you,
Thank
Ruchita ma'am, for the full session.
Thank you everyone for giving me the opportunity. And sorry for the inconvenience of some connectivity problem was there in my laptop. So it took a long time to start the sessions. Sorry once again.
So all thank you all participants. Just meet in the for the next session. We will let you know on our WhatsApp group. And to be connected, definitely join our group so that you learn more on exercise and sports psychology. Thank you, everyone.
Thank you, madam.
Well,
Thank you.
welcome back. माझा तर व्हिडिओ